Hi dear viewers, welcome to BMC Global Live Hilal Health World. Today I'm Gowri Priya with you, and with us we have Dr Rajani Ramachandran. She is a gynecologist with 13 years of work experience and is currently working in Al Hilal Medical Center, Salmabad. Before we move on, please do not forget to like and share our Facebook page, and also like, share and subscribe our YouTube channel. So doctor, welcome to the show.
Hello.
Yeah, so we are having you again as per the audience request. So last episode we talked about PCOS, and this time we are here with yet another topic. So I heard that you're going to speak about pre-pregnancy care. But doctor, I've heard about care during pregnancy and after our delivery. But what is pre-pregnancy care? Why do we need to care before getting pregnant?
Yeah, a nice question, Gowri. Like all of you might have heard, like a woman seeks or goes for a doctor when she is pregnant, or she is called for a postnatal checkup after she has delivered. But pre-pregnancy care is something is now so important and advocated, so much so that it's become a real important thing in the modern era. So what exactly is pre-pregnancy care? Well, the word itself can be again broken up into like pre is before. Pregnancy or conception is the process of becoming pregnant, and care is a set of interventions that is done to optimize one's health. So pre-pregnancy care would simply mean a set of interventions that is inculcated to optimize a woman's health before the pregnancy, before she embarks on this journey, so that in the future when she really decides to get pregnant, she is a healthy mother, and so she gives to a birth to a healthy baby. That exactly would explain like what pre-pregnancy care is all about.
But why is it so important to have care before a pregnancy?
Well, Gowri, like in our daily practice, we really get happy when we see some women walking into our OPD asking for, women in their 20s who are like newly married, and they're really not thinking about having a pregnancy in the near future. And they know really that age has bad effects on the effects of the age on the eggs are really bad as you get older. So they come and ask us about egg freezing. And the very many women, majority of them in most of the countries, come into a doctor, and that is really saddening, walk in at just the 3rd month or the 4th month or maybe the 7th month.
Okay. Why is it sad that they walk in at 3rd month or 7th month? Is it too early or too late?
From a doctor's perspective, it is late, Gowri, because by the time a woman misses her period and comes to you with a positive report, which usually is after a week she tests, like she might wait for her period like a week more, and then she finds that her pregnancy test is positive. By the time she seeks the help of a doctor, most of the the brain and the spinal cord is mostly formed. There's something called the neural tube, and that closes at around 4 to 5 weeks of gestation. So that is around the time that she comes, that is 1 week after her missing of period. That early organs like heart is beginning to form. By 9 weeks of time, that is around before 3 months of the gestation, that is the pregnancy, most of the organs are formed. That is why we cannot intervene. Suppose she is a hypertensive, diabetes, with uncontrolled sugars, the damage is already done. If she is on certain drugs that she is not supposed to be, it's already damaged the organs that are forming. And they have already formed by the time they come at 7th or 5th month. We can do just nothing. So that is why it is so necessary. Such women are told the importance of what preconceptional care is. And according to the CDC, that is the Center for Disease Control and Prevention, says that preconceptional care can really do wonders by preventing adverse maternal and obstetric and fetal outcomes. Like a lot of women born have preterm deliveries, premature babies born, and so there are a lot of low birth weight babies. The babies they die during birth, or after birth succumb to complications that the mother had during pregnancy. Also, a lot of women come with unintended pregnancies, like, unplanned ones. Like, Gowri, like, more than 50% of the pregnancies the world over in most countries are unplanned. Many people are not even ready for it. So, all these can be prevented if you just take a step backwards. So, there is a paradigm shift now. Earlier, it was told a healthy mother gives birth to a healthy baby. But I would the clinicians would take a step backwards. A healthy woman makes a healthy mother, and a healthy mother makes a healthy baby. That's why it is so important.
So doctor, earlier you had talked about embryo freezing and egg freezing. Is it really possible to come after like 20 years and then get a healthy baby after having your embryo freezed for 20 years? Is that possible?
Yeah, if you, it was there on, I think, the 3rd of December in BBC News, Washington. Well, it mentioned about a particular person, Tina Gibson, when she was just 2 years of age in the year 1992. Okay, and there was a couple at the same time who donated the eggs for embryo being frozen. Their 2 embryos, they had given their embryo, donated the embryo, and it was frozen from that time, 1992. And when Tina grew older, now in like 2017, when the 2-year-old girl, baby, when she was in 1992, now in 2017, after having through sleepless nights of not having children, she finally, decided to, adopt a baby at the embryo stage.
Okay.
So 2017, they adopted the embryo, and the girl is now 3 years old, Emma, and lately it was frozen for like 24 years. And that record was broken by another embryo that they adopted, and that was like frozen for like 27 years and thawed only, this year, maybe the last year, because the child was born, baby was born in October, that is Molly. And Molly and Emma are like biological sisters because it was from the same parents. But the thing is, like, this just shows that maybe embryos can remain, for very many years and maybe infinite. So that is how science has developed. So the women who are like having problems, like, as I told you, age is a factor. So they may not be considering on embarking on the journey of pregnancy right now, and they would want to, keep it for another 20 years. But age has its own problems on the embryo, on forming, it has lot of mutations and stuff like that. So that can be preventing by freezing it at that particular stage.
Okay, so are those babies healthy which are born by the freezing of embryo?
Yeah, of course. Mostly they are. They are just like normal. And it is, we do not know like all the embryos are going to be this one, but Emma and Molly are doing good. And there are a lot of women who have used donor embryos and frozen embryos and now doing good.
Yeah, okay. Dear viewers, now we'll be going for a short break. We will be back soon. You are listening to BMC Global Live at Hilal Health World.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now. NEC Remit has launched Send and Win. Download NEC Remit app now.
Welcome back to BMC Global Live Al Hilal Health World. Again, I'm Gowri Priya with you, and with us we have Dr. Rajani Ramachandran. So, Doctor, when do we start this pre-conceptional care?
Well, Gauri, the whole goal of pre-conceptional care is to identify risk factors in the women in the reproductive age group and improve their health in general. So it may not be even done in a woman who's contemplating pregnancy, need not be necessarily married. So it can be initiated when you see a girl in a reproductive age, might be 20, unmarried, maybe married, okay, who has just had a childbirth. So any visit to the doctor, like it could be for irregular periods, like I told you about polycystic ovarian syndrome last time. These women usually have overweight and have infertility problems. So you can always tell them to optimize their weight, you know, take care of the weight. This can lead to infertility later on. You might have a lot of diseases like hypertension, diabetes. Be careful because at the 20, if you tell them, maybe by 30 they do something about it. It's not like, you know, you can do something about your being 140 kgs suddenly, you know. If you're on the overweight side, you can always go for bariatry, sleeve surgeries. So this is done like earlier on. So you just warn them at whatever visit they have with the doctor. You need not really wait for an opportune moment where you break the news, like, you know, this is preconception care, like that. Otherwise, they might visit you for a urine pregnancy test, like they just missed a period, and so you tell them, okay, if you're trying to get pregnant, these are the things you have to do. You have to start taking folic acid so that the baby doesn't have problems, and you can just see if there are any risk. They might just come to you for a postnatal checkup. They've just had a delivery. 45 days later, you always call them. So they might have gone through a lot of trauma during their pregnancy, like difficult delivery, forceps, vacuum, or a cesarean. They're not really interested in having another baby. And when you do not tell them the importance of contraception, they land after around 4 months with a pregnancy positive and crying like, you know, I'm not ready for this physically, emotionally. And then going on contraception is of no use. So you initiate preconception counseling wherever you can. And also there might be women seeking your help for infertility treatment. They might come for a contraceptive advice. Even premarital counseling, you can even tell about, you know, what this is all about.
Okay. How do we go about it, doctor?
Well, as I told you, Gowri, the three things that are really important. One is a proper detailed history taking, because I told you it's all about risk assessment. So you have to take a proper history, have a good physical examination of the patient, and also run a few laboratory investigations.
Okay. What kind of history are we taking?
Like, first of all, like you note the age of the patient. If she's like a younger girl, like who's like in 20, 25 or 35, so it will change what you can modify with the age. So you note the age. There are a particular race and ethnicity. Like Asian population are more prone to some other problems than other races. So you note the ethnicity of the patient, and also you go into detailed medical and surgical history. They might be suffering from chronic illnesses like hypertension, diabetes, thyroid disorders, cancers, epilepsy. There are umpteen number of conditions that they might be having. Please make a note of all that. And then what we do is, like any surgeries, both on the husband and wife. If the husband has suffered from any hydrocele, varicocele, that has an effect on you know, fertility. And also in the women, surgeries around the abdomen and the pelvis, make a note of it. And then what we do is like go into the history of the previous pregnancies.
Okay. How does the age matter?
Well, age matters in a way that, you know, if you're like younger and you're not ready for a pregnancy, and you just want to put it away, then I told you egg freezing is an option that can be given, but every time it wouldn't be a good option, because sometimes she might be running other risks, like, you know, chronic morbid conditions, which may not allow her to, you know, delay pregnancy.
Okay.
In that case, if a woman is like, not ready for a pregnancy, it would be really good to, get a doctor's appointment, talk to your specialist, like these are the diseases I have and these are the medicines I'm taking, and this is my scan report, or have a discussion with the doctor. Is it right in her part to delay pregnancy, or should she go for a oocyte preservation, freeze her eggs? Because the doctor takes the final call and just gives a counseling like, you have so many conditions. Though we can do the egg freezing, the medical conditions that she suffers from may keep increasing with age. And it may not be really good, because we can freeze the quality of the egg, but we may not be able to maintain the quality of her life and her chronic condition. So there are many things that go into, taking a decision. Then, as I told you, like we go into the obstetric history, like, pregnancy, if she has had any problems during her pregnancy, like did she have diabetes during pregnancy, did she have high blood pressure, did she have bleeding, and any other problems, like, was it an assisted delivery, did she have a preterm delivery? So all these go into, taking note of all this, so these don't repeat themselves. So also the history, after having taken the medical, surgical, obstetric history, we go into what some of the personal history, like what occupation. Now more and more women go out of the house, there are no more housewives, they all work because of the urbanization. So there are many women in the factory, they might be exposed to harmful pesticides, fumes. So in such cases, if she is contemplating pregnancy in the near future, say a year or 3 to 6 months, she might get a job change to some part of the factory which doesn't have this harmful solvents and toxins, and she can go to something that is different. She can talk to her employer and go for a different part of the same industry. So that is like she can relocate to a different category altogether. Also, I come from a medical field, so we have like nurses, doctors exposed to, too many body fluids, like needle prick injuries, in which case what is the thing that we can use gloves, we can protect ourselves, take hepatitis B vaccine, so that we are more like not prone to all the infections that can be transmitted through exchange of body fluids. And also you have like radiographers or radio technicians who are exposed to harmful ionizing radiation in the X-ray and the CT department. So these women also can take a shift to another place which does not expose them if they are contemplating a pregnancy. Also there's some beauticians, they are working with dyes, hair dyes and fumes from that. So just they can go to a section like, that doesn't harm their baby if they're contemplating a pregnancy. Also there is epoxy resin which is used. Those fumes are really bad for the baby. It's used for craft, as it's a latest hobby for some of them. So that is something to be taken care of. So it depends upon what occupation you're doing. Veterinary doctors can be prone to animal bites, and cat feces can cause toxoplasmosis. So handling animals with care and pet cats, you have to be really wary of when you're contemplating a pregnancy.
Does addiction matter?
Yeah, it really does, Gowri, like smoking, alcohol, marijuana, cocaine use has to be totally be a no-no. So if you're thinking on the lines of pregnancy, believe me, smoking causes hypertension. In men, it causes less of sperm counts and problems like hypertension during pregnancy. The baby is affected, growth retarded, growth restricted, placental changes are there, preterm births are there, and it is for the passive smokers also. So if you're living in an environment that you need the baby to come into a good environment, both the partners have to stop smoking. Alcohol has deleterious effects on the baby too. It is called fetal alcohol syndrome. Babies are born with small head, there's mental retardation, there are craniofacial abnormalities. So substance abuse really needs a modification if you're contemplating pregnancy in the near future.
So doctor, how does the family history or the genetics matter?
Yeah, it really is very important, Gowri. Like there are some autosomal recessive conditions like cystic fibrosis, Tay-Sachs. In some ethnicity, you have sickle cell disease and thalassemia. You might have heard about it. So these are like autosomal recessive conditions. You know, both parents carry one gene in one of the chromosomes, like the two alleles to each chromosome. So they have one copy that is like, you know, has the defective gene. So does another parent. So if it is a consanguineous marriage, if they are like cousins, the parents are going to be totally normal, but the child born to such parents might suffer the disease. So paternal karyotyping can be done, like if there is a family history of sickle cell anemia, cystic fibrosis, Tay-Sachs disease in the family, if you have anything like a history that says that, you can subject the parents to paternal karyotyping, that is both the parents undergo karyotyping, gene mapping is done, and you can find out which is the defective gene, and you can also, you will be told that, you know, if both of you have a baby together, it is like, you know, having the chance of a defective baby is very high. So such people can be told about what contraception can be done, and there are also like options in some people, like you can go for embryo biopsy, which I will be touching upon later on. So this is about the history, like I told, about age, ethnicity, the medical, medical, surgical, previous obstetric history, your occupation, your addictions to substance, and also about the family and the genetics. So this is basically about the history part.
So doctor, before you are told about physical and lab tests, what do we do during the physical test?
Well, physical test basically means we examine the patient after we have taken a detailed history, noted all the problems like age, ethnicity, all the history. Now we come down to really handling the patient. So we assess her anemia, like, you know, is she having any pallor, that is they look pale when they have less of blood. So that's called anemia. You rule out on examination. You look for their blood pressure, is it in the normal range? You measure the weight and height. Look the BMI, that is the body mass index. It has to be maintained at 18 to 24.9 for a healthy pregnancy. So you just see any deviation from the normal. And then very common in women is hypothyroidism and hyperthyroidism. Hypothyroidism is more common, and you look for clinically, you look for any goiter and enlargement of the thyroid gland. And having done all this, you even subject them to, you know, a per speculum and internal examination to rule out any infections are there, and take a high vaginal swab if needed. So these are some of the things that we do when a patient comes in.
So doctor, by now it has been time for us to wind up this episode.
Yeah, Gowri, in this episode I have covered like what exactly is preconceptional counseling, when it is started and how it is done, and we have gone through what the history is, what lab investigations and physical examination findings are. In the next episode I will be talking about how you can modify these risk factors and do something about it.
So thank you, doctor, for being here. So dear viewers, thank you all for listening, and we'll be back again next episode talking about the modifying of the risk factors. Please do not forget to like and share our Facebook page. Also like, share and subscribe our YouTube channel. I'm Gowri Priya with you, and with us we have Dr. Rajani Ramachandran. Also, BMC will be starting a BMC News Live every night at 9 p.m. Please do not forget to watch it. Thank you.